Hi everyone, I'm Dr. Astha Dayal and I am the lead consultant gynecologist with CK Birla Hospital in Sector 51 in Gurgaon. I just wanted to check if I'm audible, then I can continue talking. Yeah, so thank you all for joining in. Hi Amrita, am I audible? Is it okay to start? Hi, so I am Dr. Astha Dayal and I am working in CK Birla Hospital in Sector 51 in Gurgaon. And I'm really glad that today the Mompreneur Circle has invited me for this talk on coronavirus in pregnancy. And it's a very good effort on their part to basically spread knowledge and awareness in this way. And in this time of the pandemic, I think it's a very, very thoughtful thing to do, and I'm really glad that I'm a part of it. So initially, I just want to talk about a little bit whatever information I want to give to all women who are either pregnant or are planning pregnancy at this time. And then I would be happy to answer your questions if you have any. So basically, this time is a very what should I say, tricky time for all of us. It's a very difficult time. We've just been on the second wave, and it has been a very bad. Like the outcomes of this wave, it has been really worrying, and we've almost reached the peak now, and hopefully we're plateauing now. So when we had this lockdown last year, we were much more comfortable in pregnancy. Also, I think we had most of our patients were fine. But in this way, we've noticed a lot of complications, and now we know a little more about the COVID virus. We are still learning every day, but we still know a little bit. So I thought I'd first like to tell you that what happens if if pregnancy happens in this coronavirus epidemic. So theoretically speaking, COVID virus is affecting pregnancies in a more severe way that we have discovered now. What happens is that pregnant women have a little different physiology, and उनका थोड़ा सा immunity level भी थोड़ा कम होता है. So although you are not at an increased risk of catching infection, but if a pregnant woman gets the infection, she is more likely to get a serious infection, and she is more likely to require oxygenation or ventilation or ICU admission. And this we've noticed in the second wave of the pandemic more so. However, having said that, majority of the women are still mild cases. 90% of the women will be having just a mild flu, or will just be having a little or asymptomatic, and they will recover well. So it is not to scare you, but I'm just telling you that pregnant women are more vulnerable, and especially so if you're obese, if you're diabetic, if you're hypertensive, if your age is above 35, and as Asians, we are more prone to the complications. Secondly, if a woman is getting seriously affected, then there are also some effects seen on the pregnancy, like there is a higher risk of preterm labor, there is a higher chance of a cesarean section, although an asymptomatic or a low or a mild case of COVID does not necessarily need a cesarean section. But sometimes if you go into preterm labor or because of other factors, you end up with a cesarean section more commonly than a normal delivery. Third, you could also have other pregnancy complications, although they're very small observational studies. We have not seen any anomalies in the baby, but yeah, we've noticed some higher rates of miscarriage, of growth restriction, of absent liquor after a COVID episode. So generally, so we have to understand that pregnant women are more vulnerable. So what should you do? Now, if you're already pregnant, what should you do? So the first thing is all the precautions which all women have to take, you have to take at a much, much higher level. You have to be very, very careful that you're following all norms of social distancing. You are not stepping out of your house unless really, really necessary. And you're not stepping out of your house without your double mask or an N95 mask. And stepping out of your house does not mean going into your lift and your staircase without the mask. The moment you're stepping out of your door, your mask has to be on, and it has to be above your nose and mouth, and it should be covering the nose and the mouth properly without any leakage. And cloth mask is not enough. You have to wear an N95, or you wear a double mask with one 3-ply mask and a cloth mask. So these are you have to be careful about, is that you although we are telling you to be very careful, but you still have to follow up with the doctor for your antenatal visits and your antenatal appointments. There are certain ultrasounds, vaccinations which are necessary. So be in touch with your doctor. Try के जो भी आपके अपॉइंटमेंट्स है, जितने भी वो ऑनलाइन या वीडियो कंसल्टेशन से हो सके, try and do more of that. Whenever it's really necessary, your doctor will call you. If you really have to come to the hospital, try that your ultrasound and vaccination and everything consultation happens in the same visit, so you don't have to go to the hospital again and again. Pre-book your appointment, make sure that there is no waiting, and it's not a very heavy slot for the doctor, so you don't have to expose yourself to too many people. And at home, what you can do, you have to take care of yourself, you have to take care of your pregnancy. So you have to be having a good diet with a good amount of protein, vitamin C, vitamin D, zinc, all these things you can add as supplements in your diet. Then you also have to keep yourself well hydrated. The third thing is that you have to exercise, you have to be mobile, because we are all in this lockdown. There is no place to go out, but you can do some antenatal yoga if your pregnancy is low risk. You can do some simple walks, stretches, breathing exercises. You should do all that while you're at home. And also take care of your mental health. It's very easy to be stressed these days, but you have to understand that stress is also a bad thing. It can adversely affect your pregnancy. We are seeing so many things outside. I think you should just shut yourself from all the negativity and the negative news and the WhatsApp forwards and all. Don't spend too much time on that. It is important to be aware, but okay, you can spend, maybe half an hour in a day I'm going to see the news, but I'm not going to fret about it the whole day. And you also have to occupy yourself in some things which are positive. Connect with your friends and family, so that because there is isolation also. You're socially isolated, and there are people having financial issues also. So it is very difficult not to stress over it, but try your best to occupy yourself into positive things, into some mindfulness, some hobby you want to pursue, some affirmations, whatever helps you in keeping calm, because that is what your priority at this point is, your pregnancy. So you must be careful. Now, there is this flu shot that we give in pregnancy. You must take that flu shot because it might give some cross protection to COVID also. The COVID vaccine currently is not allowed by the government of India to be given in pregnant and breastfeeding, but it has recently been, because it is otherwise an inactive vaccine and it is a safe vaccine, लेकिन उसके बहुत सारे trials नहीं हुए हैं, so we are not very sure how safe it is in pregnancy because we've not tried on pregnant women. However, it is an inactive vaccine, and vaccines generally have a good track record. हमको usually कोई complications मिलती नहीं है vaccines लगाने से. So the Indian National Technical Advisory Group, which is NTAGI, they have agreed to give in pregnancy and lactation, but now the government has to give the final approval. So we are waiting for that. If we get the final approval, then at least you should get vaccinated, because as I said, pregnancy is a high risk state, and if you get vaccinated in the 3rd trimester, you can also give probably some protection to your child. So these are the things that you have to do if you are pregnant. Now, also you have to keep in touch with your gynecologist. अभी जो आपका labor and delivery and care होगा, थोड़ा सा उसमें difference होगा. Hospitals are following guidelines, and we are testing people before admission. If you're negative, you have the normal care, but we don't allow attendants. There's only one attendant who is also supposed to be tested and stays with you throughout those 3 days. You do have a normal delivery, cesarean, labor monitoring, everything else goes on normally. So you don't have to worry so much. It's just that we will probably not allow you too many attendants coming in if you go into labor. Now let's look at a situation. Suppose if, God forbid, a woman becomes COVID positive. Now what's going to happen? And you are pregnant. So the first thing is you have to recognize if you've had contact with anyone who's COVID positive. And here I'd like to mention, आप अपने घर में रह रहे हो, लेकिन if there's anybody in your household who is stepping out for work, you have to socially distance yourself from that person also, because that person could be bringing an infection. So you have to be careful even inside the house. And nowadays we are talking of aerosol transmission. So even in your neighborhood, or even if somebody in front of your house in the street has gone and sneezed, and so the COVID virus can stay in the aerosol. So that is why you don't have to step out without the mask, but be wary of people who are stepping out. So in case you have a contact, or if you start having any symptoms like fever or cough or headache or breathlessness or body ache or diarrhea, nowadays any sort of symptom, the first thing that we have to think of is COVID. So you should be aware of these symptoms. You should not live in denial. Loss of smell is a very big symptom. So if you have any of those things, then you must be contacting your doctor as soon as possible. Most people you don't have to panic. Most people do have a mild illness, and as I said, 90% of the people will recover. So don't panic. You should keep a pulse oximeter with you, a temperature measuring thermometer with you. You can keep a the steamer with you. So these things you have to manage at home, and you have to monitor yourself well. You have to take your physician's consult. You have to start medications that they advise. And you have to keep monitoring your temperature and your saturation, and and take the medicines as they've advised. And in most cases, you will recover. And if you're not close to delivery, usually there's no problem. You stay at home for 2 weeks. Once your quarantine is over, then you can go, and then generally I prefer calling the patients for an evaluation of the baby. So you can get yourself and your baby checked after the quarantine period. So, and your usual visits can be adjusted accordingly. Now, if you start getting, if this thing happens closer to delivery, then if you're mild and you have no symptoms or mild symptoms, we try and wait if we can to postpone delivery. But if you're getting sick, then, or if we really need to deliver, then we still do the delivery. It's not, and sometimes people go into labor themselves, so the delivery will happen. It's not that you will be stranded or anything. We are taking care of people who are getting positive also. And if you're mild, then the labor and delivery happens in the exactly same way. It is just that you are kept in an isolation room, and the people who come in will be wearing a PPE to see you. So it is important that don't fret over it, but also be very aware of your SpO2, of your temperature. Now, if you feel that your SpO2 is falling, or if you really need that oxygen requirement, then your doctor will advise you on admission. And most cases, again, even if 10% people require admission, out of that also 90% will recover without any severe complications. So be positive. We have seen that positive thinking actually helps people come out of the ICU faster, and you have to be strong for your child. It is, basically, in most cases, you do recover. So that's what I said, that don't worry, your delivery, labor, everything will be taken care of, even if you turn positive. Now, let's see, for people who are planning pregnancy, or who've had COVID and then now they want to plan pregnancy. So now that is it's a very personal choice, basically, because I do get a lot of patients who are telling me that is this a good time to plan pregnancy, because we are not, we don't know where this pandemic is going. So I agree, it's a very complicated question. There could be a third wave coming. This coronavirus might stay for another couple of years. But we are getting more aware of the treatment protocols. We are more in control of the situation with increasing time. And if it is here to stay, it's really a personal choice. If you want to plan pregnancy, you can do it. But I would really advise that you take the vaccine before you plan pregnancy. You can plan pregnancy. So if you've had COVID, generally you should give a break of a month or 6 weeks and then take the vaccine. If you've had mild COVID, so when can you plan after you've had the vaccine, or if you've had the COVID infection? So after the vaccine, you can take a month's break and then you can start planning naturally. About 6 weeks is a good enough time to wait, although there's no theoretical reason to wait. It's just that the vaccine does not affect your fertility. If you want to plan, you should just complete the course. Only because it is currently not allowed in pregnancy. So I would prefer that you complete the course and then start planning for pregnancy. However, our IVF experts and fertility doctors are saying that if somebody has taken the vaccine, and since for them it's sort of a semi, so we cannot waste too much time for people who are undergoing these treatments. They can even start treatments 2 weeks after the vaccine has been taken. So the vaccine will not really affect your fertility. Also, there was a myth going on that you should not take it during your periods. That is also not true. Any vaccine or any sort of stress and anxiety can make your cycles irregular because it plays with your immune system. And all these irregularities or heavy period or light period will get okay in a couple of months. So you don't have to worry about it. You should not delay your vaccination if you're getting your period. Now, so basically, if you want to plan, you can plan, but take the vaccine. Now, for breastfeeding women, if you've delivered, then also once the vaccine permissions are granted, I think you should go ahead and take it because it will give some immunity to your child also, and it should be a very safe vaccine to take. Now, okay, so this is basically what I wanted to say. Now, let me see if I have any questions. Okay. So yeah, so hi Lopa, you've asked that if a pregnant person can pass COVID to the baby. Now this is a very valid question. There have been a few studies which have shown of this shown that this vertical transmission has happened. So when they've checked the babies and the newborns, they have seen in the last wave itself, they saw some cases that the baby also was testing positive. But the babies have a very mild infection. They probably just have a mild fever or flu or loss of appetite. But if a woman is also, if you get COVID, you're also transmitting immunity to your child. And secondly, women are allowed to breastfeed because we weigh the risks and benefits. If a woman is, suppose if she's COVID positive and she delivers, and now what do we do? Should we keep the baby away from the mother? That's generally, so those were the risks and benefits that we that we weighed, and we understood that breastfeeding is very important, and even if a little bit of possibility of passing COVID to the baby exists, that illness is going to be very mild in the child. So a pregnant woman is allowed to breastfeed. You are supposed to wear a mask when you're breastfeeding. You are supposed to follow all norms of social distancing, hand washing, hand hygiene. And you can either breastfeed directly, or you can use a pump and express your breast milk and give it to a caregiver who is COVID negative, and that person can breastfeed your child, can give the breast milk to the child. Now, rooming in, also WHO has changed their criteria. They're saying that if the mother wants to stay in the same room, then they can stay 6 feet apart. But if you have a possible, I would say that if there is a option of allowing somebody else to take care of the child, and the child comes to you only when the child has to feed, that is allowed. So even if there is a little chance of transmission, it is okay. The child is only getting a very mild illness, and it is safe to even breastfeed. Okay, so I have a question from Amrita that one of her relatives is expecting and very scared. Okay, so I think Amrita, stress has become a very, very big part, and I think last year 1/3 of my patients did have some sort of depression or some sort of anxiety, and it is but natural. We've also had our close ones suffer, and it scares all of us as well. But we have to be strong. We have to fight it out, and she has all the reason to do it because she has to do it for her child. I think what you can do is be a positive influence for her and try and inspire her to be more positive and calm her. And if she takes all the precautions, at most she will not get it. And God forbid, even if somebody gets COVID, it does recover in 90% of the cases. So why fret over it and stress over it? I think all you can do is just take the possible precautions and hope and pray that everything stays okay. Another question is that is it ideal to plan a pregnancy now or to postpone it? Which I think I told you that it's a very personal choice. You should take the vaccine definitely before planning pregnancy. Okay. Now another question I have from Latika is that there's so many people who are getting scared as their delivery time is coming near. Yeah, so as the delivery time comes near, you are scared anyways, because you're generally, when there was no COVID, then also women used to get scared because they was inherently scared of the labor, of the delivery, of what's going to happen and all that. And now it is like multiplied multifold because of the COVID, because of isolation. You don't get to talk to friends and relatives. There's no mothers are not allowed inside. So it's very tense, the situation. But you do not have to be scared, because the things will happen as they. So generally, all hospitals who are taking care of COVID versus non-COVID patients, they are doing the obstetric care in the similar manner as anybody else would get it, whether you're COVID or non-COVID. So our protocols of delivery of cesarean are not changing as much because we are still giving the same care. And especially in my hospital, we do allow one attendant with the patient in labor all through delivery, and you get the same support, and our sisters are very nice. So basically you don't really have to worry about the laboring part. But yes, you have to prepare yourself. We tell you to keep testing yourself. If there's any fever, cough and all that, you have to test. And in fact, 2-3 weeks before your due date, you should not be stepping out, so that there's no chance of catching an infection. Also, you should keep your birth bag ready. You should keep in touch with your doctor. You should know whom to contact when you have to come in labor. And on routine testing, this has happened. On routine testing, if you have no symptom, but you could be an asymptomatic person, on routine testing, if you were posted for delivery and then your test comes positive, then also you don't need to worry. You might be needing some extra tests. You might have to delay for a couple of weeks. But I've had many successful deliveries after that also. So don't worry so much. And precautions will actually be the same as normal precautions, which is your hand hygiene, mask, double mask, social distancing, staying at home, and also exercising. If you're keen on a normal delivery, or even if you have a cesarean, I think taking care of your own health is the most important thing. Because that is going to help you recover faster, and it will make you less vulnerable to any other infections that you can catch otherwise. So it is important that you take care of your health, take care of your diet, exercise regularly, and also think positive. I have also had a lot of patients who had some family member who got positive, and because of that stress, they sort of it affected their pregnancy so badly that it got a lot of side effects in their own ultrasound, their Dopplers, their Leica and all. So basically, your state of the mind, your mind actually controls your body in a big way. So you all have to be strong. And as humans, we've actually survived this last year, and we're going to survive now as well. So just be positive. That's what I wanted to say. And I think, okay, let me see if there are any more questions. Yeah. So, okay, so I have a question on water birthing. Now, water birthing is somewhere close to my heart because I did the first water birth in Gurgaon and in my hospital. Water birthing is okay to do if you are COVID negative. We are allowing it. If you're negative, everything is the same. If you're positive, then there are higher chances of infection to the staff also, and the water also, keeping the water, basically maintaining the sterility of the water, and the whole process becomes a little difficult. But if somebody is positive, then we are not allowing water birth. But if somebody is negative, then it's an option that they can go for. But for water birth, anyways, you should be fulfilling all the criteria which are generally advised for water birth, which means you should have an uncomplicated pregnancy, term pregnancy, you have to go into labor on your own, and it's a very straightforward pregnancy going on, no complications, and you start getting contractions on your own, then you can opt for a water birth. Also, the other pain relief methods, like there are different kinds of pain relief methods in labor. So water birthing is okay if you're COVID negative. Entonox is another thing that we give, which is a gas mixture of nitrous oxide and oxygen, which you take during contractions. You breathe it in, and then after the contraction goes, you leave it. So these two options are there for you if you're COVID negative. But if you're positive, then we don't allow these two, because there is because this is an inhalational form of analgesia, so it's not allowed, and water birthing also because of the spread of infection. But epidural is allowed, and epidural is actually the most effective form of pain relief. So we can give epidurals even if you're COVID positive, and that is why you can even opt for a normal delivery when you're COVID positive. So you don't have to be scared of the labor pain as such, even if you turn positive. Okay, so I think I'll wait for a couple of more minutes if we have more questions. And otherwise, also, if you post questions later on, I'll be happy to answer them. So thank you so much for, I think there are no more questions. So I'm really glad to be a part of this session, and I'm really thankful for all of you for patient listening, and I hope it was helpful. And thanks to the Mompreneur Circle for organizing this. Thank you so much.